Welcome, dear viewers. Today we talk about the symptoms of colds and the solutions. Understanding common cold symptoms. What are the symptoms of a cold? Symptoms of a cold can be felt about 1 to 4 days after catching a cold virus. They start with a burning feeling in the nose or throat, followed by sneezing, a runny nose, and a feeling of being tired and unwell. This is the period when you are most contagious. You can pass the cold to others, so it's best to stay home and rest. For the first few days, the nose teems with watery nasal secretions. Later, these become thicker and yellower or greener. You may get a mild cough. It won't get much worse, but it is likely to last into the second week of your illness. If you suffer from chronic bronchitis or asthma, a cold will make it worse. Because the common cold weakens your immune system, it can increase the risk of a bacterial superinfection of your sinuses, inner ear or lungs. Community-acquired pneumonias can start as a common cold. If symptoms get worse, rather than better, after 3 to 7 days, you may have acquired a bacterial infection. These symptoms can also be caused by a cold virus other than a rhinovirus. Usually there is no fever. In fact, fever and more severe symptoms may indicate that you have the flu rather than a cold. Cold symptoms typically last for about 3 days. At that point the worst is over, but you may feel congested for a week or more. Except in newborns, colds themselves are not dangerous. They usually go away in 4 to 10 days without any special medicine. Unfortunately, colds do wear down your body's resistance, making you more susceptible to bacterial infections. If your cold is nasty enough, seek medical attention. Your doctor likely will examine your throat, lungs, and ears. If your doctor suspects strep throat, they will take a culture and determine if you have an infection and may need antibiotics. If they suspect pneumonia, you will need a chest X-ray. Call your doctor about a cold if 1. You notice an inability to swallow. 2. You have a sore throat for more than 2 or 3 days, particularly if it seems to be worsening. 3. You have an earache. 4. You have a stiff neck or sensitivity to bright lights. 5. You're pregnant or nursing. 6. Your newborn or infant has cold symptoms. 7. Your throat hurts and your temperature is 101 degrees Fahrenheit or higher. 8. Your cold symptoms worsen after the 3rd day. You may have a secondary bacterial infection. Can I prevent flu or cold symptoms? The most important prevention measure for preventing colds and flu is frequent hand washing. Hand washing by rubbing the hands with warm soapy water for at least 20 seconds helps to slough germs off the skin. In addition to hand washing to prevent flu or cold symptoms, you can also get a flu vaccine to prevent seasonal influenza. Seasonal flu activity in the United States generally peaks between late December and early March. Within 2 weeks of getting a flu vaccine, antibodies develop in the body and provide protection against flu. Children receiving the vaccine for the first time need 2 doses delivered 1 month apart. Antiviral medicine may also help prevent flu if you have been exposed to someone with flu symptoms. Cold remedies: what works, what doesn't, what can't hurt. There's no cure for the common cold. But what about cold remedies that claim to make you feel better faster? Find out what's effective, and what's not. Cold remedies are almost as common as the common cold, but are they effective? Nothing can cure a cold. but some remedies might help ease your symptoms and keep you from feeling so miserable. Here's a look at some common cold remedies and what's known about them. Cold remedies that work. If you catch a cold, you can expect to be sick for 1 to 2 weeks. That doesn't mean you have to be miserable. These remedies might help you feel better. 1. Stay hydrated. Water, juice, clear broth or warm lemon water with honey helps loosen congestion and prevents dehydration. Avoid alcohol, coffee and caffeinated sodas, which can make dehydration worse. 2. Rest. Your body needs rest to heal. 3. Soothe a sore throat. A salt water gargle, 1/4 to half teaspoon salt dissolved in an 8-ounce glass of warm water, can temporarily relieve a sore or scratchy throat. Children younger than 6 years are unlikely to be able to gargle properly. You can also try ice chips, sore throat sprays, lozenges or hard candy. Use caution when giving lozenges or hard candy to children because they can choke on them. Don't give lozenges or hard candy to children younger than 6 years. In the end, we ask you to share with us your personal experiences with colds. If you want more towards a better healthy life, please subscribe. See you soon.